Good afternoon, everyone. Gareth Presch, founder of the World Health Innovation Summit. I am delighted to welcome you to our global partnership launch with Red January. Hannah is with us. Hannah Beecham, founder, CEO of Red. And I think this is a bit of a groundbreaking moment for me because I started my Red journey about 6 years ago, actually a park run when I was trying to run every day in January. So to be able to work with Hannah is a real honor. Very grateful for this opportunity. We're going to talk about Red and its initiative and what World Health Innovation Summit and Red plan to do over the coming months and years. Build out that ecosystem, give people the tools to manage their own health and well-being. But let me hand over to Hannah. Hannah, please give people an insight into Red and the fantastic work that you've been doing.
Oh, Gareth, can I just say it's such an honor to be collaborating with you and your vision in this way as well. So, and I don't think I knew about the 6 years of taking part in Red January. That's amazing. That's so brilliant, and makes this partnership all the more meaningful as well. So, yeah, Red January, we're going into a decade of Red, and Red January is a nationwide health movement that's empowering people to move in a way that works for them and their lifestyle. And really, it's about educating, inspiring, and instilling movement habits that will support people all year round. We're also part of a year-round mission. So when you get involved in Red January, there's the option to fundraise, and it goes towards incredible movement and mental health projects in local communities, so people can still enjoy the benefits of movement in a way that works for them as well. We have been so fortunate throughout the past few years of having such meaningful collaborations, where the role really of that collaboration is to reduce the barriers to people being able to support themselves through movement. So this partnership, we're so excited to be bringing it to life over the coming years.
No, it's fabulous. And I just wanted to bring up a short slide that we prepared. I just want people to have a visual to understand what we're doing here. On the left-hand side is really disease management, which is the current health system. And people will have seen me present this before. It's basically about being ill health. And at the moment, what we want to try and do is shift the model towards preventing disease. Hannah's work with Red January, that's exactly what we're talking about. And also the opportunities to boost the economy by keeping people fit and well. When we did our proof of concept in Cumbria here from 2015 to 2018, we were able to demonstrate £1 invested 36 back. Now, I know Red has been doing similar sort of work around its impact. And I'm sure that when we come together and combine our efforts, we can increase that £1 in 36 back to 150 maybe. So this is where it gets very exciting. And I think as you build these programs, like we had children's mental health and well-being, social prescribing, for example, all these new models of healthcare, these will create new and meaningful jobs. Hannah, just back to you. Please just share a little bit more about the impact of Red on people's health and well-being, mental health impact, and then also just share the future of Red and where you want to see this go. I know we're going to go to Helsinki together in a few weeks. I'm very excited by this partnership.
Yeah, so am I. And we, like I said, we've had so many meaningful partnerships. One of them has been with the University of Oxford. So they were our research partner for a number of years. And what we found was that, and this won't come as a huge surprise, but when people move more in a way that works for them and their lifestyle, it has a huge impact on emotional health, on well-being. We saw that people experienced a significant improvement in their happiness levels, stress levels, generally the way that they thought about themselves, their self-esteem increased. And actually throughout the year, it just had a huge impact on the things that they did for themselves as well. So yeah, Red January can really support and set people up for the year in such a nourishing way. It can really enhance people's lifestyles. In addition to that as well, so we know we've taken all the learnings from the UK over the past 10 years. And last year we stepped into Canada, an incredible team over there that launched Red January Canada. And again, we've seen that, especially when there's inactivity levels in the winter, when people experience lower mood and lower energy, having an initiative and a program like Red January can make all the difference. So we're excited to be taking Red January outside of the UK to support as many communities as we can. But also in the UK, there's still so much work to be done here, as you were describing there. So we've only just scratched the surface of what a Red January can bring to people's lives.
That's what I like about this, being able to transfer the knowledge in the UK, research, evidence base. You mentioned Oxford, one of your partners, fantastic. And being able to bring that to lower middle income countries that won't have the systems or services to actually provide, won't have the hospitals for these treatments, but offsetting those long-term costs by giving people the tools to manage their own health and well-being. That's what I love about this initiative. Hannah, just the last final word from you. The vision for Red January 2030, where do you see yourselves? Keep in mind the projection that we're on.
Yes, yeah. So the idea, well, the hope is that people embrace Red January. It becomes a part of society. So when you step into winter, you know that there's a community out there of people all moving in a way that works for them. And there's something free, accessible, inclusive that can support you during a really challenging time of year. That's the hope, that it's ingrained in society.
That's brilliant, because that basically is delivering health for all, which is our vision. So for myself and Hannah, this is just a short introduction, but do follow our journeys. You'll see our websites, wis.world and redtogether.co.uk. Join us on this journey. We'll have more announcements coming up during the week. We have a digital announcement during the week, and then I've just come off the phone from a music announcement that we were making shortly with the Quality Music Foundation. So this is all coming. We're going to be ramping up these activities. We also will be setting up WHIS in a number of cities, and I've got some interesting announcements coming up soon. So for myself and Hannah and the Red team, I'm just very excited for the future, and to be able to work with our communities and empower them, to give them the tools to manage their own health and well-being. So thanks for joining us, and thanks very much, Hannah, for taking the time to join us this afternoon.
Oh, thank